Next, we have OCT-A, vascular changes in macula following cataract surgery.
The award will go to actually the OCT machine, sir. 50% are OCT.
Becoming OCT specialist.
By Dr. AISWARYA Savior.
So the topic is OCT-A, vascular changes in macula following cataract surgery. Cataract is an avoidable cause of global blindness that can be effectively treated with cataract surgery. It is essential that we know the changes in capillary circulation at fovea after an uncomplicated cataract surgery, as it can predict macular ischemia and thereby postoperative visual prognosis. OCT-A represents a reliable non-invasive tool for detecting retinal blood flow parameters with high degree of repeatability. The aim of my study is to estimate the change in the vessel density, perfusion density, and foveal avascular zone before and after uncomplicated cataract surgery, and also to compare the same among diabetics and non-diabetics. It was a cross-sectional study done from September 1, 2022 to August 31, 2023 at Believers Hospital, Tiruvalla. A total of 32 non-diabetics and 31 diabetics was included in the study, and all of them had an uncomplicated cataract surgery with posterior chamber IOL implantation. We excluded patients with intraocular pressure more than 21 mm of mercury and with history of ocular trauma or intraocular surgery, or with any retinopathies other than mild diabetic retinopathy, or with any history of previous lasers to the macula, or poor OCT images, unstable fixation, intraoperative or postoperative complications with OCT angiography signal strength less than 5. All participants underwent routine examinations prior to cataract surgery, and OCT-A scans was taken preoperatively at any time before surgery and postoperatively at 3 weeks, 6 weeks, and 3 months. OCT parameters like vessel density, perfusion density of the central, inner, outer, and full area, as well as foveal avascular zone area, perimeter, and circularity index in the superficial capillary plexus of all participants was evaluated preoperatively and postoperatively. The comparison of all these parameters between diabetics and non-diabetics and the rate of change of these parameters over time between the two groups was done with generalized linear regression model. A total of 63 patients was studied, and 32 was non-diabetics and 31 was diabetics. Among the diabetics, 21 had non-diabetic retinopathy and 4 had mild non-proliferative diabetic retinopathy. So this is a vessel density graph in diabetics and non-diabetics. The red bar denotes diabetics and the blue one denotes non-diabetics. And we see that vascular density was higher among non-diabetics when compared to the diabetics, and there was post-operatively increase in the vessel density in both the groups equally at 3 weeks post-op visit, and it remained almost the same at 6 weeks and 3 months. Similar findings was also noted in the perfusion density in diabetics and non-diabetics. And coming to the FAZ, the FAZ of the non-diabetics was lower than the diabetics, and post-operatively there was a decrease in the FAZ area, perimeter, and circularity index, and there was significant decrease in the perimeter and the circularity index at 3 weeks of post-op, and then it remained almost the same. So coming to the discussion, almost all of the other studies was synonymous with our study, and it also showed an increase in the vessel density and perfusion density and a decrease in the foveal avascular zone area changes. A decrease in the intraocular pressure, post-operative inflammation, and an increase in the light exposure was reported to be the reasons for the increase in the vessel density and perfusion density post-operatively. But some studies denied the role of decrease in IOP and post-operative inflammation and upheld the light exposure to be the primary cause for the increase in the vessel density and perfusion density post-operatively. So coming to the conclusion, there was a significant increase in the vessel density and perfusion density and a significant decrease in the FAZ perimeter and circularity index in diabetics and non-diabetics post-operatively from the preoperative value. The exact cause for the increase in the vessel density and perfusion density following cataract surgery is unknown and is a scope for future research, and the macula, which is compromised in diabetic retinopathy, shows an increase in the vessel density and perfusion density following cataract surgery, Whether these changes are only transient and what effect they will have clinically need to be studied further. So these are my references. Thank you.
Any reason for this foveal avascular zone decrease in size after cataract surgery?
They say that there is
Because you have told something for other things, other parameters. But avascular zone decrease, how can it happen after cataract surgery? In what way is related?
They say that there is an increase in the vascularity following cataract surgery due to changes like increase in inflammation and light exposure. So, yeah.
What about avascular zone? That zone is increasing. Vessels are growing now.
Because of the vascularity itself, the zone is getting decreased in its size. Thank you.